Hi, my name is Megan and I'm going to be demonstrating medication administration. I'm going to be doing all four in this video, so it's kind of long, just bear with me. Okay, so first things first, before I get started, I just want to read off the 10 rights of medication, which is right drug, right patient, right dose, right route, time and frequency, documentation, history and assessment, drug approach, right to refuse, drug interaction and evaluation, and education information. Alrighty, so the very first thing that I would do, I am recording on my laptop, so I'm not going to look in my computer for the MAR. I have it written down right here. So that's what I'll be referring to right here is my MAR. So the first thing that I would do is I would verify the orders. So if I was looking in the computer, I would open up my patient's chart, make sure that everything looked good. I would see that they had a order for a subcutaneous injection of Humalog, which is insulin. And I know that insulin lowers blood sugar and that the side effects for it could include rash or an itchiness. And for my patient, Jonah Dinerman, he has a blood glucose level of 249, so that means I'm going to be administering 6 units of Humalog subcutaneously. Also, it says here that since he does have a breakthrough pain of 7 out of 10, I'm going to be administering 50 milligrams of mepridine hydrochloride, which is the generic name for Demerol, which is also a narcotic, and it is a pain reliever. I'm going to be giving that intramuscular injection. And since it is a narcotic, I will be assessing my patient 30 minutes after administration of the pain medication. And I know that I have to use the 50 milligram as opposed to the 25 milligram that's in the MAR, because he did say that his pain was 7 out of 10. Now, when I do go into the room, I will assess his pain and make sure that it is still a 7 out of 10. If for some reason it dropped or it was more than that, then I would reassess and figure out my next step, which would be changing medications. Next, we have the Nitroderm patch, 0.3 milligrams, and that is a nitrate, so it prevents angina and chest pain, so it really helps to widen the blood vessels, and there's some side effects that you look out for, which is headache, nausea, dizziness. Also with the nitrate patch, the Nitroderm, you really want to make sure that you're monitoring your patient's blood pressure, because that's really important. Next, we have the phenytoin, which is PO by mouth, so it's like little tablets. And it's the anti-epileptic. It blocks the seizure activity. 50 milligrams of that as well. Some side effects to look out for is headache, nausea, dizziness, and constipation. And the warfarin sodium PO, which is an anticoagulant, and it's a blood thinner, and it helps prevent blood clots. So that's another thing that you should look out for with an anticoagulant blood thinner is headache, vomiting, bleeding, joint pain. And also I know that in the MAR it says that this particular medication, the warfarin sodium, is to be administered at hour 1700, but just for the sake of this video, I'm doing all the medications at a 9 a.m. med pass. And I'm also administering 5 milligrams of the warfarin sodium. So that was my first check, just checking the orders in the computer. And then the second check is I'm going to be actually pulling my medication. And while I'm pulling the medication, I am going to be looking and making sure that all the labels are correct with my MAR. So I'm basically just going to do exactly what I did again. I'm going to start with my Humalog, which is my insulin. Right here, we're going to be doing 6 units of this because my patient has a blood glucose level of 249. Next, I have the mepridine hydrochloride, which is Demerol, 50 milligrams. also an injection, intramuscular. So I'm going to check, make sure that, it's not expired, that if it's a multi-use vial that, the last person who used it dated and signed, and make sure that everything is good. Then after that, we have the phenytoin, 50 milligrams, right here. And this is the anti-epileptic. And this is going to be taken by mouth, PO. Then I have my Nitroderm patch and my warfarin sodium, which I know is at the wrong time. Like I said, for the sake of this video, we're just going to do it all at a 9 a.m. med pass. Okay, now since everything is pulled and I double checked everything, my second check with the MAR, I'm going to go ahead and prepare my medication, which would be my third check. And if I still didn't feel very confident, I would have a second nurse check basically everything that I'm doing from start to finish, just to make sure that I did everything that I needed to do. Okay, so I am going to wash my hands before I prepare my medication. Wash my hands. Okay, now the first thing I am going to be preparing is my Humalog, which is going to be my insulin. It's also my subcutaneous injection. So with a subcutaneous injection, the size that you want for everything is a 28 to 31 gauge with a 0.3, 0.5, or 1 milliliter syringe. So it's pretty small. Okay, so the first thing that I would do is I would take, there we go. Get the MAR out of the way. So the first thing that I would do is I would take my alcohol swab and I would swab the top of my vial like so. Okay. Then I am going to take my syringe, and I'm going to pull back 6 units of air. So when I pull back the 6 units of air, I want to make sure that I go very slow and that I really am on the 6 unit line, because this vial acts as a vacuum. So what I push into it is what I will initially be pulling out of it. So like I said, I'm going to pull back 6 units of air. I'm going to go ahead and dart it into the vial, push it. I'm going to push the 6 units of air into my vial. I'm going to flip it upside down like so, and then I'm going to pull back 6 units of insulin. Then I'm going to safely cap and label and date and make sure that I know that this is my Humalog, which is my subcutaneous, which is my insulin, and I have it ready to go next to me. Okay. Also too, if this was a multi-use vial of insulin, I would make sure that I dated and initialed it. Also too, since this is Humalog, which is insulin, I am going to have a second nurse check everything from the MAR to the order to the preparation to me actually administering the medication. Okay. Turn my MAR over. Next, I'm going to be doing my Demerol, which is the mepridine hydrochloride, and I'm going to be doing this one intramuscularly. So, kind of the same thing applies. I have my vial here. Before I begin, actually, the kind of syringe that you want for an intramuscular injection would be an 18 to 27 gauge with a 1 to 3 milliliter syringe. And I know that if I were to use this in the deltoid area, I would not be able to do over 2 milliliters of medication, so I would have to administer them in 2 different injections. But that's only for the deltoid. Okay. So now that I have the right, everything's good, I'm going to take my alcohol swab, let her dry, and then I'm going to pull back 50 milligrams of air. Okay, then I'm going to dart it, push the 50 milligrams of air into the vial, flip, pull back 50 milligrams of the medication. I would do the safety precautions for it. I would label the syringe, date, time, the right medication, so I know which one is which, and I would set that aside. Also, if this, again, was a multi-use vial, I would date and initial it, just to make sure that the next person that uses it knows when it was opened last, so it wasn't expired. Okay, then next we are going to get our Nitroderm patch ready, which is a 0.3 milligram patch in the alcohol swab. And here, I don't have a little cup. Oh, I have a water bottle lid. Okay, so this is going to be my phenytoin, 50 milligrams. And I see here on the bottle that 1 tablet equals 50 milligrams, so he is going to get 1. And also for the sodium morphin, 5 milligrams. We'll say 1 cap is 5 milligrams, so he will get 1 as well. And I will set those aside. Okay, now that I have all of my medications set up, I'm going to go ahead and gather all necessary supplies, which I have it all right here, maybe just some extra gauze and alcohol swabs, and I will be going into the patient's room. Okay. Hello, Mr. Dinerman. I'm Megan. I'm going to be taking care of you today, and I'm going to be giving you your 9 a.m. medications. Keep you down like this so you can see. Okay, so the first thing that I would do is I would ask the patient for their name and their birthday, and I would make sure that it matched up with the armband. I would make sure that all medications, again, matched up to the MAR and also to the name band of my patient. While I'm doing this, I'm going to be also doing my OE wipes, providing safety, providing privacy, doing everything necessary for my patient, getting water, anything that they need. Also at this time, I'm going to assess all of my medications for my patient, so it's more also like a teaching moment as well. So I'm first going to ask about the pain, because pain is most important, so I'm going to make sure that I make sure that his pain is still a 7 out of 10. So I would use, say, Mr. Jonah or Mr. Diamond, can you use some words to describe your pain for me? And he says that it's sharp. Can you rate your pain for me on a scale of 1 to 10? And he says 7. And I say, where is your pain located? And it is on his right heel. I ask, is it consistent? And he says it's intermittent. And does anything alleviate it or make it worse? And he says, it hurts when he dangles it. So, then I assessed my Demerol. And I also am assessing that when his blood sugar was taken, it was a 249, so that right there is his insulin. And also too, while I'm doing this, I'm going to be educating my patient as in, this patch is for, your nitrate, and this is your insulin for your blood glucose level. This is your pain medication for your foot. And yeah, let me turn over my MAR here. Okay, and then I would also say, this is your seizure medication and this is your blood thinner. Now, the patient does have a right to refuse medication. That is one of the rights of medication, is the right of refusal. So you really want to make sure that you, educate your patient on what medications that you are administering at the time. Just in case they don't want to take it, then they have every right not to. Okay, also I would prepare my patient, so I would, sit him in high fallers or whatever position is comfortable for him. get everything ready, and I would also verify his allergies. And our patient at this time has no food allergies, no medication allergies, and no seasonal allergies, which is awesome. Okay, so now that I have everything ready and everything is checked, I did my 3 checks, everything's going in the right place, I'm going to go ahead and get my patient ready and don my gloves. Okay. So the first thing that I would do is I would give Mr. Dynaman his PO medications and a glass of water if he needed some water. And I would let him take it at his own pace, but I would let him know, Mr. Dynaman, I am going to sit at the bedside and make sure that these are taken. So he took them. Nope. He took them, no problem. Some water. Okay. And also too, before I would give my patient his medication, I would just look back at the MAR one more time to just double check. That's a personal preference for me. I just want to make sure I'm giving my patient the right medication. Okay. So sorry, my MAR is going everywhere. Okay, and then after that, I would, document that the medication was in fact taken. There was no refusal, anything like that. Anything that the patient has to say or anything that happened. So then next I would move on to my Nitroderm patch, which is my nitrate, which is, again, helps with the angina, helps with breathing. So, if my patient did have a prior patch, so we can just say that this one was on the stomach. So if this were to be the case, I would, assess the patient, make sure that it's okay if I took it off, make sure that it's the right name, date, and time that matches up with his chart in the computer. Whoever did it, who charted last, I want to make sure that that's right. All right. So everything's good, so then I would peel back, make sure everything's good. I would check skin, I would check the integrity, I would check for any lesions, anything out of the ordinary, and if everything's good, then I would definitely rotate my injection, or rotate my site for the patch, because that's one of the big things you want to make sure that you rotate. So, oh, I totally forgot. So when you take it off, like so, wherever per policy procedures, but for the sake of this video, we are going to dispose of our patch in our hand, and we're going to take our gloves off, like so, and discard of it like that. So the old patch is inside of here. But just bear with me, because these are my only gloves, and I have to reuse them. So after I went to take off the old patch, I would go ahead and wash my hands again and don some more gloves. And I would rotate the site of the patch. So I'm going to be putting it on his arm now. So what I would do is I would assess, the skin, make sure that it's in a good spot. There's no cuts, lesions, anything like that. And if it's good, then I would take my alcohol swab, and I would start from the circle, and I would work my way out like so. Let it dry. Then I would take my patch, my new patch. I would go ahead and I would stick it on, and I would press for 10 seconds. I'm not going to massage or anything. I'm just going to put pressure on my patch for 10 seconds. And then once it's on, I'm going to date time, and initial or sign. Also, the location, anything that's important, vital information, but definitely the date, time, and my name. And then once that's on, I would go ahead and I would document it, and I would, type that the patient got the nitroderm patch on his right arm, skin was intact, name, date, initial. Just make sure to document it. Make sure, also too with the nitrate, this is one that you really want to make sure that you come back and assess your patient, especially their blood pressure. This is a big one. Okay. Now next I'm going to be moving on to my intramuscular, and that is going to be my I'm sorry, it's so hard for me to say. Mepridine hydrochloride, which is Demerol. And that is my intramuscular injection. And like I said, that is going to be the 18 to 27 gauge with the 1 to 3 milliliter syringe. So I have everything ready right here. So I know that I'm going to tell my patient that he's going to lay on his side, and I'm going to be giving the injection in the ventral gluteal site, which is on the side, kind of like right in this area. But I do know that you can also inject this into the deltoid or the vastus lateralis, but I went with the ventral gluteal. So I would have my patient lay on his side, make sure that everything was good. And to find the actual spot, I would put my palm down like so. I would spread my fingers, and in between my pointer and my middle finger would be my injection site. So I would make a marker and realize that that's where my site is going to be. Then I would take my alcohol swab. Okay. Let it dry a little bit. Then I would go ahead and do my Z-track. So you're basically going to be pulling the skin taut, like so, about 1 to 1.5 inches, just depending on the size of your patient. And then you're going to go ahead and take your Demerol. You're going to dart it like so, dart position, and stick. And then you want to insert and then secure. Inject, and while this is all going on, you really want to make sure that that needle is secure. And then you can, for the intramuscular injections, you really want to aspirate for 5 to 10 seconds to make sure that you didn't hit, it's not an intravenous, you don't want any blood in there, so that's why you would aspirate for 5 to 10 seconds. And if no blood is present in the syringe, then you are good, you are successful. So then you go ahead and take it out, get your gauze, apply pressure, not massaging, just kind of applying pressure. Okay, and since that was the Demerol, the narcotic pain medication, you must go reassess your patient in 30 minutes from the time of the injection, just to reassess their pain level. Okay. And so for the next one, we're going to be doing the Humalog, which is the insulin. And there's a few different areas that you can do this at, but for this specific video, I am going to be doing it in the abdomen, about 2 fingers down and away from the umbilicus, so around in this area. And a big thing that you want to make sure with insulin, you want to make sure that you're rotating the site, the injection site. So you want to look on the computer beforehand and see where the last injection was, and wherever it was, you just want to rotate it from that spot. So that's what we're going to do. So I have my insulin here ready, 6 units for 249 blood glucose level. So I am going to go ahead and have my patient lay down. Everything's okay. I'm going to pinch about 2 inches of skin like so, and I'm going to, depending on the size of your patient, you want to go from a 45 to a 90 degree angle, just really depending on the size, but My patient is pretty average size, so I'm going to go ahead and pinch about 2 inches, and then I'm going to go ahead and go at a 90-degree dart, and I'm going to inject, make sure that my needle is nice and secure. Okay, pull it out, get my gauze, apply a little bit of pressure. Okay, so after then I would finish all that, I would gather up all of my supplies, all of my medication, take my gloves off. I really am going to be focusing on reassessing my patient in a half hour for his pain. And I am also going to be reassessing his vital signs just because of the blood thinner and the seizure medication and the nitroderm patch. I really want to make sure I'm monitoring breath sounds, blood pressure, pain scale, all that good stuff. And then I would document. I would do documentation. Reassess my patient, make sure that everything's okay, that they don't feel nauseated, there's no headaches, there's no bleeding. Make sure my patient drank something, ate a little bit of food. And I just want to stress on, again, that if I were to have insulin, it would be a second nurse check. And for my narcotic pain medication, I would, again, every 30 or after the medication, 30 minutes after would be a reassessment of my patient's pain. And with the nitroderm patch, really make sure that you're paying close attention to the heart, the blood pressure. And I think that is it. Oh, also too, I know that the sodium, the warfarin sodium was supposed to be given at 1700, but like I said, for the sake of this video, I did it at 9 a.m. med pass. So that's medication administration. Thanks.